Hello guys, so welcome back. So today we shall be discussing another important topic in microbiology, that is the spore forming bacteria, right? So what is this spore forming bacteria called as? It is a Clostridium species, okay? So in this session we shall be discussing one of the most important Clostridium species out of all the different types of Clostridia, right? So this Clostridium species is nothing but called as your Clostridium tetani. Okay, so which is responsible, all of you know that Clostridium tetani is responsible for causing tetanus, right? Now, one thing that whether it is gram positive, let's start from the basic, that Clostridium tetani, is it gram positive or negative? Obviously, this is gram positive bacteria. So, let me write it down here. This Clostridium tetani is gram positive bacteria, right? So, if we just divide this gram positive bacteria, so how am I going to divide? These gram positive bacteria are divided into three categories. Okay, there are many more categories, but for our convenience sake, there are three categories. One are rod shaped bacteria, that is bacilli. Another one is circular shaped bacilla, that is cocci. And next we have got our branching filaments. We have got our branching filaments. Okay, so when you look at the bacilli, Clostridium is bacillus, it is rod shaped. So our main concern is regarding the bacilli group. When you look at the bacilli, within this bacilli group, there are two more. Some are called as aerobic organisms, some are called as anaerobic organisms. So there are two groups, right? There are two groups. Some are called as aerobic organisms and other is called as anaerobic organisms, right? So what is your concept of this aerobic and anaerobic? What are the examples of aerobic and anaerobic? The examples of aerobic and anaerobic are, and keep one thing in mind, that the organisms which are going to write down in aerobic and anaerobic group, all of them are bacilli and all of them are gram positive. So the first example which comes as we are discussing the topic in the anaerobic group, that is Clostridium tetani. Not only Clostridium tetani, there is also another bacteria called as Propionibacterium. Propionibacterium. When it comes to the aerobic group, what are the group of organisms? One is called as your Listeria, right? That is Listeria monocytogenes, right? Next one is your Bacillus, that is Bacillus cereus, Bacillus anthracis, right? Next one is Corynebacterium. Corynebacterium. So Corynebacterium in the sense, you know, Corynebacterium diphtheriae. So all of these are aerobic bacilli which are gram positive, right? All of these are aerobic bacilli which are gram positive. Now, if I ask you what is the shape? What is the shape of this gram positive aerobic bacilli by name Clostridium tetani? What is the shape of this Clostridium tetani? All of you know it is bacillus, but exactly I am asking you the shape. The shape of this bacteria is drumstick shaped, right? So Clostridium tetani is drumstick shaped bacteria. So what do I mean by drumstick shaped bacteria? This would be an MCQ, very important. So what do you mean by drumstick shaped bacteria? So this is how the bacteria looks. For example, or tennis-racket bacteria. You see, this is how the bacteria looks. So this bacteria which I am drawing here is in the form of a drumstick or is in the form of a tennis racket. I can also call it as tennis racket shaped. Tennis racket shaped bacteria, right? So tennis racket shaped bacteria or drumstick shaped, rod shaped bacteria, everything is this Clostridium tetani, right? Now another important thing which I want to highlight is that within this drumstick shape appearance, there is one very important thing. I'll explain you this later on, right? So look at these bacteria in the slide here. Look how these bacteria are there. These bacteria are like drumstick. So that's what I told you. They are drumstick shaped bacteria, right? So they are drumstick shaped bacteria, right? So if I have to get an infection from this Clostridium tetani, so how am I going to get it? What are the risk factors which are responsible for causing this Clostridium tetani colonization in my body? What are the risk factors are? All of you very well know the most important risk factor is wounds, right? So whenever you get exposed to the wounds, whenever you get exposed to wounds like metal wounds, right, metal wires or any kind of metal pins, when they get pricked, and if you're not taking proper measurements or if you're not taking any kind of antitoxin, so obviously you will be affected with this Clostridium tetani. There are high chances that you would be affected with this Clostridium tetani. So if I list down, guys, if I list down the risk factors, if I list down the risk factors of this Clostridium tetani, very important, guys. So the first risk factor will be, what will be the first risk factor? Not wounds. The first risk factor will be lack of vaccination. If you are not get vaccinated, if you didn't get vaccinated, that is the DTaP vaccine, Tdap vaccine, all of this we will be discussing in a minute. So if you didn't get any vaccine from this bacteria, so obviously you will be affected with this bacteria. So lack of vaccination, right? The second thing is the trauma, obviously the wounds. Third thing is, if you have got a wound that is not washed, that is there persistent for a long time, this is called as chronic wounds. Chronic wounds. So for example, if some diabetic patient, he has got hurt or he fell down somewhere, so obviously you know in diabetes the wound heals very poorly. So there are high chances for this chronic wound to get infected. So lack of vaccination, trauma and chronic wounds are the very important and the highest risk factors that are associated with this Clostridium tetani. Now let us look at the properties of this Clostridium tetani. First property, all of you very well know that this is a gram-positive rod, and second property is it is anaerobic. It is anaerobic organism. It is not aerobic organism, it is anaerobic organism. And third important and the most important point is this, that this Clostridium tetani is a spore forming organism. Why am I so concerned about spores? I'll be explaining in a minute why spores are very important. Spores can even be fatal to your life, right? So these organisms are spore forming organisms. So these are basically your spore forming organisms. Not only that, one very important thing, do all Clostridium species form spores? Yes, all Clostridium species, they form spores. Next, coming to the hemolysis. What type of, I have been discussing hemolysis in almost every video in detail, and even I'll do the same with this video, that what type of hemolysis does this Clostridium tetani undergo? So the hemolysis which is undergoes is alpha hemolysis. Alpha hemolysis. Now what do I mean by alpha hemolysis? What do I mean by alpha hemolysis is, as you can see in this picture, there are three types of hemolysis. One is alpha, beta and gamma. Look at alpha and beta. Which is more vibrant, which is more bright? Obviously it is beta. Why? Because surrounding the beta, if there are 100 RBC, almost all the 100 RBC are lysed. Almost there is hemolysis of almost all the RBC. So there is not even a single RBC that is left surrounding this beta. So this beta which I have drawn here is nothing but the bacteria. This alpha which I have drawn here, it is nothing but the bacteria which I have drawn in that shape. I have pasted that bacteria in that shape. Okay. So can I tell beta hemolysis as complete hemolysis because it has not left a single RBC? It has broken down almost all the RBCs, right? In the same way, when you go to alpha hemolysis, surrounding the alpha hemolysis, look, is there any zone of vibrance or zone of brightness over there? No. So obviously there is a little bit zone of brightness. I can call it as a zone of paleness, because surrounding alpha, whatever RBC are there, let us say there are 100 RBC surrounding this alpha. Out of 100, this bacteria, this alpha hemolytic bacteria could lysis only 50 RBC. And the 50 RBC are still staying there. That is why the zone that is surrounding, the border that is surrounding this alpha hemolyticus, that shape alpha, is pale. Why? Because there is few cells hemolysis, partial hemolysis. So can I call this as partial hemolysis? partial hemolysis, or I can also call it as alpha hemolysis, right? Not only alpha hemolysis, what is the color there? It is green in color. I can also call it as green hemolysis. I can also call this thing as green hemolysis. Why should I call it as green hemolysis? Clostridium tetani is alpha hemolytic bacteria, right? Which means Clostridium tetani undergoes green hemolysis. Why should I call it as green hemolysis? Because this bacteria which is there, this alpha hemolytic bacteria, what does it do is that I told you it will break down the RBC, right? So let us for example see that this is an RBC. All of you know RBC has got hemoglobin in the center. When it breaks down the RBC, so what will happen? This hemoglobin will be released out. Hemoglobin, right? So this is hemoglobin. Sorry with the spelling, but this is hemoglobin. Hemoglobin is further broken down into two compounds. One is called as globulin. Globulin is a protein. So protein will be broken down to what? Amino acids. And the other one is heme, right? Now this heme will further be converted into biliverdin, and biliverdin will be converted to bilirubin. So this biliverdin, whatever is there, this is green in color. So if it is breaking down 50 RBCs, so 50 biliverdin molecules are produced, and that what makes this alpha hemolytic bacteria look green in color. That is why I wrote alpha hemolysis as green hemolysis. But there is one small twist here. What is a twist? That, for example, I take an agar plate, I put sheep RBC into that. Now I will add alpha hemolytic bacteria, that is Clostridium tetani. Now keep watching it for 10 to 20 minutes. I will find alpha hemolysis, that is partial hemolysis. And I keep it there and I write down in my notes, in my record, that this bacteria is alpha hemolytic. But after half an hour to 1 hour, slowly I see that there is complete zone of hemolysis. Previously 50 RBC have been broken down. Now the remaining 50 are also broken down. Right. So it means, can I tell this way, that alpha hemolytic bacteria have been converted into beta hemolytic bacteria? Right. So Clostridium tetani, if I ask you what is the property, Clostridium tetani is alpha hemolytic, but later on it will be converted to beta hemolytic bacteria. Why? Because it is breaking down all the RBC. That is why it is converting from partial hemolysis to complete hemolysis. So can I write that it is converting from partial hemolysis to complete hemolysis? Partial hemolysis to complete hemolysis. Very, very important, right? So why is this so? Why is this happening? Why is it converting from partial hemolysis to complete hemolysis? The reason is that, guys, because of very potent toxin. All of you know the reason for beta hemolysis is release of a potent toxin called beta hemolysin, right? Streptolysin. In the same way, the reason of converting from alpha hemolysis to beta hemolysis is because of this Clostridium tetani releasing a very important potent toxin, Clostridium tetani. This Clostridium tetani basically, right? So this Clostridium tetani basically releases 3 types of toxins, guys. It releases 3 types of toxins. And what are these 3 types of toxins? The first toxin is tetanospasmin. The second toxin is tetanolysin. And the last toxin is non-spasmogenic toxin. So what are the different types of toxins that are released? One is tetanospasmin, another one is tetanolysin, and the third one is non-spasmogenic. So here I'll take this opportunity to discuss about tetanolysin. So alpha hemolytic bacteria, that is Clostridium tetani, it is releasing tetanolysin in the starting. So less amount of tetanolysin will be released, and that less amount of tetanolysin will, for let us say that this Clostridium tetani bacteria is releasing 50 molecules of tetanolysin. This 50 molecules of tetanolysin will break down only 50 RBC, and that is why we call it as partial hemolysis or alpha hemolysis. But later on, after some time, when I put it there and write my records, after half an hour to 1 hour, when I slowly see the number of tetanolysin molecules release is increasing now. Previously 50, now 100, 200 tetanolysin molecules are released by this bacteria. So when they are released, these 100 to 200 tetanolysin molecules will break down all the RBCs surrounding it. So that is why it is converting it into beta hemolysis. Okay. So what is responsible for causing hemolysis here? That is tetanolysin. So this is an important thing here. Right. What is tetanus spasmin? I will be discussing it in a minute about tetanus spasmin. But before that, guys, I want to discuss some very important things here itself. Right. Again, I will discuss these things when I complete the entire Clostridium species. But here, I will take this opportunity to discuss one of the important thing that for your exams, Clostridium tetani. Right. Clostridium tetani is responsible for causing tetanus. All of you know that. Second important thing, there is also another Clostridium species called as Clostridium botulinum. Clostridium botulinum. And what is Clostridium botulinum responsible for? Causing botulism. Botulism is a food poisoning, right? Third thing, we have also got Clostridium difficile. So what is Clostridium difficile? And Clostridium difficile is responsible for causing pseudo membranous colitis. It is responsible for causing pseudo membranous colitis. Next important thing, Clostridium perfringens. And what is it responsible for causing, guys? It is responsible for causing gas gangrene. It is responsible for causing gas gangrene. So these are some of the most important things which you have to keep things in mind. Okay. Right. So this is one of the important box which you have to keep it in mind. Right. Before that, we were discussing the properties, right? We discussed it is gram-positive rod. We discussed that this is gram-positive rod. It is anaerobic organism. All of the species form the spores. It is alpha hemolytic. And let me discuss the interesting point that these spores are heat and chemical stable. Heat and chemical stable. Why do you think these spores are heat and chemical stable? What is the reason behind them? The reason behind them is, guys, previously in the picture I told you that this drumstick appearance, within the center of the drumstick appearance you find some pinkish color there, right? So let me draw it once again. And explain you. This is the drumstick appearance. Now within this drumstick appearance, right, I found some pinkish coat here. This is called as the capsule or the coat of the bacteria, or also called as the cortex of the bacteria. This is the cortex. Within this cortex, I find some green color dots inside, right? I find some green color dots. Now these green color dots, they represent dipicolinic acid, right? So these green color dots here, they represent dipicolinic acid. What is dipicolinic acid? Dipicolinic acid is located in the core of this Clostridium tetani. It is located in the core of this bacteria, and this is the reason why because of this dipicolinic acid, these spores are heat stable. So if someone asks you, why Clostridium species are so heat stable, why their spores are so heat stable? Because within them, within the core of this Clostridium tetani, within that bacteria, there is an important acid called as dipicolonic acid, which is responsible for heat stability of this spore forming bacteria. Right, we discussed the properties of the bacteria, we discussed the structure of the bacteria, we even discussed the diseases that are caused by all the Clostridium species, and we have also discussed the risk factors. Now, we should discuss how this bacteria enters into your body, how this bacteria enters into your body and causes tetanus. You know, one little definition of tetanus is that, what is tetanus? Tetanus is nothing but sustained muscle contraction. All of you know that. Now, how your muscle is getting contracted like that continuously? What is the reason behind that? Now, let us discuss the pathogenesis and know what is happening there. Right? So, let us discuss. Right. So, let me make it small, right? So that it would be easy for you and me. So this is an important table here. I hope you can see it, right? So what is a pathogenesis? Now listen very carefully, guys. Don't make any notes. Now look here very carefully. This is a neuron. This is called as postsynaptic neuron, right? Now this is the next neuron. This is the next neuron. Let us say, for our convenience sake, we are telling that this is inhibitory neuron, and this is alpha motor neuron. And all of you know very well that alpha motor neuron is responsible for muscle contraction. All of you know this, that alpha motor neuron is responsible for muscle contraction. Now look what is going to happen here. My alpha motor neuron fires 24/7. It all the time fires and keeps my muscle. See, I'm contracting my muscles now. If I'm closing the fist, it means I'm contracting my muscles. So all these muscles are all the time contracted. My alpha motor neuron fires all the time and contracts all my muscles. But all the time contraction is not enough, not needed, right? You even have to relax your hand. So who is relaxing your hand? This inhibitory neuron releases inhibitory neurotransmitter like GABA, glycine and all. So this inhibitory neurotransmitter inhibits the alpha motor neuron, and that's when there is no muscle contraction and you relax your hand. So this is how contraction and relaxation, both of them are happening vice versa in your body, right? Contraction and relaxation are happening vice versa in your body. So if I want to contract, then I will stop inhibitory neuron to release that neurotransmitter. If I want to relax, then I will allow that inhibitory neuron to release that inhibitory neurotransmitter, so that my alpha motor neuron is not working. Now this is a general idea, guys. Now let me exactly enter into the details of what is happening. Then I'll apply the real concept of what is happening in this Clostridium tetani. Okay. Now look at the picture here. The same picture I will be drawing. There will be no confusion here. So this was your presynaptic neuron, and let me draw it in blue, that this is your alpha motor neuron, right? So this is your alpha motor neuron. So let me write it down. This is your inhibitory neuron, and this is my alpha motor neuron, which is responsible for muscle contraction. So I am writing it as MC. MC means muscle contraction, nothing other than that, okay? So it is muscle contraction. Now here I have a lot of vesicles. Here I have got vesicles like this, because all of you know that within these vesicles there is neurotransmitter. What type of neurotransmitter I find here? I find inhibitory neurotransmitter. And what is the example of that? It can be GABA or it can be glycine, any of these two. Okay. Now another important thing is that sitting on the top here, I have got two important proteins. These are called as ion channels. These are ion channels which you have drawn. These ion channels will have two stick-like things, okay? These ion channels will have two sticks like this. They will have two sticks. Okay. Now, these synaptic vesicles, even these vesicles also have a small stick-like process here, a stick-like process. So, what I am trying to explain here, what I am trying to explain is that this green color stick which you can see, this is called as synaptobrevin. This is called as synaptobrevin. This protein is called synaptobrevin, which is attached to the vesicle. Now, this blue color thing is called as syntaxin, which is attached to the ion gated channels. Now, only when the syntaxin molecules are like this, only when the syntaxin molecules open up, the vesicle will fit inside and then release its neurotransmitter. Now, how is that going to happen? How is that going to happen? Keep concentrate here that you have a lot of calcium in your body. So, this calcium, what is a ionic form of calcium? Ca+2. So, one calcium ion attaches here, the second calcium ion attaches to the next syntaxin molecule. So, positive, positive, they repel. So, these two sticks, these two drumstick like syntaxin molecules, they repel like this. So, when they repel, how will the picture look now, guys? When they repel, this is how the picture looks. They got repelled. Now, when they got repelled, what will happen? This synaptobrevin molecule exactly fits into that. Now, look here, very interesting. This synaptobrevin molecule, right, and it is having vesicle with the synaptobrevin, it fits into that, and there is a neurotransmitter here. It fits into that and finally comes out, and what will happen? It releases neurotransmitter called GABA or glycine here. And this GABA or glycine falls on the alpha motor neuron and causes muscle contraction. So, this was the thing I have just explained in a rough way previously. Fine. This normal thing happens in you and me. But what is the concept behind that tetanus in the patient who is affected with Clostridium tetani? The concept is that I told you in the starting, Clostridium tetani releases 3 types of toxins. One is called as tetanolysin, another one is called as tetanospasmin, right? So, this tetanospasmin, look here now, this tetanospasmin, right? So, this tetanospasmin, it is so potent that this tetanospasmin, look here very carefully, this tetanospasmin will kill down, or it will cleavage, or it cleavages or lyses these synaptobrevin molecule, and not only that, this tetanospasmin even breaks down this syntaxin molecule. So, we basically call that tetanospasmin cleaves synaptobrevin and syntaxin. Okay, synaptobrevin and syntaxin together, they are called as snare proteins. Snare proteins. Together they are called as snare proteins. Synaptobrevin and syntaxin together are called snare proteins. So, this tetanoplasmin will cleave or proteolysis. It will break down these proteins, these snare proteins. So, what is going to happen? Now, look at the picture. I am going to change the picture. So, when this is happening, do you think will I have any kind of syntaxin now? No. Do you think I will have any kind of synaptobrevin now? No. So, when there is no synaptobrevin, when there is no syntaxin, how do you think the vesicle will release its contents outside into the synaptic terminal or synaptic cleft? No. So, there will be no release of any kind of neurotransmitter here. So, when there is no release of any kind of neurotransmitter, is there any inhibitory neurotransmitter right now here to inhibit the alpha motor neuron? No. Previously there were GABA and glycine. Now there is no neurotransmitter to inhibit it. So what will happen? Alpha motor neuron keeps on contracting because there is no one to control alpha motor neuron. It keeps on contracting and the muscle contraction is so severe, you call it as sustained muscle contraction. Sustained muscle contraction. Sustained muscle contraction is what called as tetanus. So this is the pathophysiology or pathogenesis behind this Clostridium tetani causing tetanus. I hope you understood this, right? Now, another important thing is, what are the diseases that are associated with this Clostridium tetani? There are mainly two things. One is tetanus, all of you know it, tetanus, very good. And the other one is neonatal tetanus. I'll explain what is neonatal tetanus, but first listen what is tetanus. So, tetanus is sustained muscle contraction. So, within this tetanus, you will have many more things. One will be spastic paralysis. Secondly, you will have rhizus sardonicus. What is rhizus sardonicus? I'll show you the picture in a minute. Thirdly, you will have locked jaw. The jaw will be locked like this, in this way, right? This is called locked jaw, or also called as trismus. And fourth, importantly, patient will also be in opisthotonous position. Okay, what is opisthotonous position? That also I'll be telling you in a minute. Now let us look at all these pictures over here. You can see in this old man here. Now this old man is affected with this Clostridium tetani, and this particular characteristic representation which is giving, this is called as rhizus sardonicus. So all his buccal muscles, all his rhizorius muscles, everything is contracted like this, right? So this is called as rhizus sardonicus. And as you can look in this guy over here, look at the spine of this guy. How is the spine? Within the spine on the back, you have got extensor muscles, long extensor muscles. So if all these extensor muscles contract, the patient will become like this, completely extended. So there will be severe contraction of spinal extensors, and that is what is called as opisthotonous position. Opisthotonous, right? So what do you see in case of opisthotonous? What do I see in case of opisthotonous is that in case of opisthotonous, I see spasm of what? Spinal extensors. Spasm of spinal extensors. Okay, right. Another important thing is that I have discussed about spastic paralysis, right? Where do you see spastic paralysis? In tetanus, right? And tetanus is caused by Clostridium tetani. Keep in mind one thing, in case of Clostridium botulinum, also you see paralysis, but that paralysis is not spastic, that is flaccid paralysis. That paralysis which you see is not spastic, it is flaccid paralysis. This will be an important question, guys, keep it in mind. So when I write down the differences, later on I'll be writing down, once I finish all the videos, then I'll be writing down the differences between Clostridium tetani, Clostridium botulinum and the different types of Clostridia. But one difference I want to tell you here right now is that Clostridium tetani causes spastic paralysis, Clostridium botulinum causes flaccid paralysis. Okay. What is neonatal tetanus? Neonatal tetanus is that, for example, if a mother, if she is delivering today, her delivery date is today and she is delivering today by a normal delivery. So when she delivers normally, along with the baby, you even see the umbilical cord, right? So what doctors basically do is, the moment the baby comes out of the vagina, right, what doctors do is they put an artery forceps here, right? I hope you can see it, right? They put an artery forceps here, to the cord, and then they cut the cord in between. Okay, so these artery forceps which they are using and the scissors which they are using to cut the cord, if they are not properly sterilized, what can happen is that Clostridium tetani can sit on that umbilical cord and can colonize on that umbilical cord. So along with that umbilical cord, the bacteria can enter into the baby and cause tetanus, and that is what is called as neonatal tetanus. Point number one was, what did I tell you? Neonatal tetanus can be caused by unsterilized tools that are used to cut umbilical cord. Point number 1. Second thing is, another way is that, for example, if mother is not vaccinated, let us say if mother is not vaccinated and she is carrying a baby, there are high chances that it can transmit from mother to child. So unvaccinated mother, can I write it as unvaccinated mother? Unvaccinated mother. So what is going to happen at the end? There will be colonization of umbilical stump. Colonization of umbilical stump. Okay, right. So this is all about the diseases that are caused by Clostridium tetani, that is tetanus and neonatal tetanus. So how am I going to treat this patient? Before treating, prevention is better than cure. So how am I going to prevent this? How am I going to prevent this? By giving vaccine. So what are the different types of vaccines which you give? One is DTaP vaccine. DTaP stands for diphtheria, tetanus and whooping cough. That is pertussis. Whooping cough is caused by pertussis, right? So DTaP vaccine I use. DTaP vaccine is for diphtheria, tetanus and pertussis. Right. So after this, the next is Tdap. Tdap is tetanus, diphtheria and pertussis. So when do I do this? This is a booster dose. This is a booster dose I give at 11 to 12 years of age. And the final is TD vaccine. So when do I give this TD vaccine? After every 10 years, right? 10-year interval. So if if a child is properly vaccinated, then, or if a mother is properly vaccinated, then they have less chances to get affected by this disease. So let us say the baby has been affected by this disease, or the adult guy has been affected by this disease. So what is the treatment which you give? What is a treatment plan which you give? Can anyone tell, before discussing this treatment, can anyone tell, if I am affected with Clostridium tetani, you can see whenever I try to drink anything, when I try to walk, I can't walk because my muscles are contracted, there is spastic paralysis, my extensors are completely, there is contraction of all my extensors, and all this is happening. But if a neonate, a newly born, is a neonate going to complain, hey doc, I have got Clostridium tetani which is colonized from my umbilical stump? No. So how do you find it? How do you find it is when the neonate starts drinking the mother's milk. So there will be poor sucking. So when you see poor sucking, you think of Clostridium tetani infection, or also even jaundice or any other thing, meningitis also you see poor sucking. But overall, one is poor sucking, and you see this extension, spinal extension, spasticity in the hands of the baby, of the neonate. So all these things club up to the diagnosis of neonatal tetanus, right? So what is a treatment? Treatment is we give an antitoxin. What antitoxin? Tetanus antitoxin. That is also called as tetanus IG. Tetanus IG means tetanus immunoglobulin. So that is an antitoxin. That is an antitoxin. What does it do? In our body, I have a toxin now. I am affected with Clostridium tetani. In my body, I have a toxin called tetanospasmin. So if I take tetanus IG, then this tetanus IG will neutralize that tetanospasmin in my body. So it neutralizes the toxin that is located in my body. Next thing, I should also give antibiotics to the patient. So what are the antibiotics which I give to the patient? Metronidazole, metrozil or metronidazole. Third important thing is that patient is having muscle spasm, sustained muscle spasm. So what drug can I give? For muscle spasm, to relieve the muscle spasms, I give diazepam. And fourth important point in the treatment is that when you get a wound, you wash the wound properly. There should be proper wound debridement. Proper wound depriment. Right. Another important thing. For example, if this patient has been affected with Clostridium and is not under proper treatment, right? So he is having Clostridium tetanus and is not under proper treatment. So what can be the complications in his later on life? The complications can be so severe. By this lecture you understood that this is basically affecting your muscles. So muscles in the sense not only the spine muscles, hands and legs, even that can be your respiratory muscles. So what if the respiratory muscles are contracted continuously? If there is sustained contraction of your respiratory muscles, do you think your lungs, you can breathe properly? No. Can I tell there will be pulmonary compromise, respiratory compromise, right? So what will be the complications in this patient are? What will be the complications which you see in this patient are? One is spasm of respiratory muscles. Spasm of respiratory muscles, and second thing, as a result of sustained spasm, there are chances that he can aspirate the food or aspirate the water or anything into his lungs. So can I write it as aspiration pneumonia? So most common cause of death in the patients with tetanus is because of spasm of respiratory muscle or aspiration pneumonia. Right? Aspiration pneumonia. So before you watch the next video, let me write down the last important point so that it avoids confusion between all the Clostridium species, right? Anyways, we are done with the topic now, but let me write down a brief point about all the three different diseases and what are they going to cause, right? So that it would be easy for you to learn in the next video. So Clostridia, there are some Clostridia which causes gas gangrene. Some Clostridia which cause gas gangrene, some Clostridia which causes tetanus, you already know very well now, and some Clostridia which causes food poisoning. So out of all these three, which is very important is this one. Very important. So what are the Clostridia that are causing gas gangrene? Clostridium perfringens. Not only that, even Clostridium septicum. So what are the Clostridia that are causing tetanus? You know Clostridium tetani, right? So what are the Clostridia? Okay, there is a big list, guys. So let me put this thing over there. And bring this thing over here. Cool. So what are the Clostridia that are causing food poisoning? First thing is Clostridium perfringens type A. What does Clostridium perfringens type A cause? Clostridium perfringens type A causes gastroenteritis. Gastroenteritis. These are the MCQ points which you just have to remember. There is no concept in this. You just have to by heart these things. Okay. Next thing is Clostridium perfringens type C. And what does it cause? Clostridium perfringens type C causes necrotizing enteritis. Third important thing, Clostridium botulinum. What does Clostridium botulinum cause? All of you very well know Clostridium botulinum causes what? Botulism. Food poisoning. A type of food poisoning. So most commonly when you are completely dependent upon the canned foods, processed foods. So in that Clostridium botulinum is more likely to live because that is a favorable environment for that. Next important thing is there is Clostridium difficile or whatever it is. So what is it going to cause? It is going to cause acute colitis. So the reason behind me writing this table is that this is just an overview for you to crack the MCQs very easily, right? So in this way you can remember all these things like this. Clear? Right, so this is the end of the video, right? So in the next video we shall be talking different types, and in the later on videos we shall be clubbing up all of these things and we shall discuss the differences, right? Thank you.